Good afternoon. It's 2 p.m., so we'll get started with today's briefing. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director for Greenfield Health Department, Anjali Vernado, who's a CART clinician for the Milwaukee County Behavioral Health Division and MPD Specialized Patrol Division, as well as Ted Chisholm, Chief of Staff for Milwaukee County Sheriff's Office. So thank you all for joining me today. And Mayor Barrett, we'll start with you.
Well, thank you very much, Catherine. And earlier this afternoon, County Executive Crowley and I joined a number of community leaders and community members in addressing National Suicide Prevention Month. And we were able to hear some pretty compelling stories from individuals who either personally or had family members who were affected by suicide. And at this time, when there is clearly additional stress in our society as a result of the pandemic, as a result of the economic challenges, as a result of the fight for racial justice, I think we all have to pause and not only care for our own mental health and make sure that we're taking the steps necessary to maintain our own mental health, but to be attentive to others around us who might be suffering or might be challenged by this as well. And also to encourage individuals who are having suicidal ideation or suicidal thoughts, or just in a really rough place in their life, to seek the help that is there. There is help available for individuals. And we ask people to reach out either to family members or to friends, or call 211 or call others who can be there to help you, because it's very, very important that we do everything we can to make sure that individuals have the help that they need. So again, given these very, very trying times, it's very, very important for us to take those steps to reach out to individuals. Also earlier today, I was with Claire Woodle, our election director, and Joan Johnson, our library director, in unveiling our 15 lock boxes for the November 3rd election. These lock boxes, where individuals can place their absentee ballots, are going to be located just outside the City Hall complex in front of the Zeidler building, the city facility on South Kinnickinnick, as well as 13 libraries throughout the entire city of Milwaukee. We stressed during that conference how these would be secure. And that is obviously a concern, I think, for individuals who want to make sure that their votes are counted. But we also know that we are expecting probably close to 290,000 people to be voting in the November 3rd election. Over half of those will be voting either absentee by mail or through the drop boxes or in person. And this is a significant change from what we've seen in previous presidential elections. And so our emphasis is on security. We want to make sure that these lock boxes are secure, so they will be bolted. There will be 24-hour surveillance of these boxes. They will be cleared at least every day between now and the election, and as we get closer, more often than that. And make sure that people's voices are heard. And we know that voting by this method is probably the safest, although some people would prefer to vote in person. That is going to be available both at over 170 sites on election day, as well as our early voting sites that will be number 15 throughout the city, plus Miller Park, plus the Fiserv Forum. So we're taking every step we can to make sure that we're giving people an opportunity to vote in these critical elections in November. The county executive is going to be talking about the excellent work that the county is doing with the CART program. We're pleased to have been their partner in our efforts to have mental health available for individuals. We know that this remains an issue, and that having the critical access of people who can help individuals who have been victims of crime or have been experiencing crime. We know that that's important, and that's a priority for the city of Milwaukee as well. So there's a lot going on. You'll be hearing more in the coming weeks about conversations that we have had with the governor's office and the National Guard, because we're going to maintain the testing of the National Guard through part of the fall, but then it will be transitioning to city workers, and we're working out those details right now. That will come, more information will come with that, but that is something that we're very interested in. Dr. Weston was on that call as well, and he's been extremely helpful in navigating this for us also. So I want to thank the county executive. I want to thank Dr. Weston. Again, the governor's office has been very, very good to work with on this, and we are immensely thankful to the National Guard for the work that they've done up to this point. So with that, I'll turn it over to the county executive. Thank you very, very much.
Thank you, Mayor Barrett, and thank you for not only your leadership, but your partnership on this. As folks may be aware, today is World Suicide Day, and September is Recovery Month. And as the mayor stated, the city and the county came together just this afternoon to acknowledge these tough but very, very important topics. The Milwaukee County Medical Examiner's Office stated that current trends show we'll likely surpass last year's numbers for suicides, stating that there were 23 suicides last month alone. The Milwaukee County Office of Emergency Management August data shows that EMS calls compared to last year are up. So when you think about those who made phone calls for psychological needs, the calls were up 60%, 34% for overdoses, and up 72% for suicide attempts. These increases are unsettling, and we're seeing these conditions affect our communities of color more than in previous years. The pandemic has really exacerbated the stress placed on folks and is impacting folks' well-being. And since the beginning of this pandemic, I've always used the term physical distancing, not social distancing. That's because humans need social connection. We're going to be living through this pandemic for a long time, and we must find ways to stay connected with our loved ones. And as Dr. Weston has mentioned on Tuesday, social isolation can lead to heightened mental health illnesses and suicide. So we must be watching for signs and symptoms that our loved ones may be struggling. And if you or someone you know is having suicidal thoughts, call the National Suicide Prevention Hotline at 800-273-8255. You are never alone, and there are people to help you on your journey. And one way to address these challenges facing residents is through accessibility, culturally sensitive, and community-based services. As the mayor mentioned, the city and county have partnered since 2003, pairing Milwaukee Police Department officers and other behavioral health division mental health clinicians to provide mobile services that better meet the needs of our residents, especially those going through a mental health crisis and looking for support. The county and city CART division is an example of mental health experts working collaboratively with an urban police department to serve its community and create better results. And this is an innovative model. And we are way ahead of many urban cities in implementing this type of service, but more can be done. The Milwaukee Police Department and Milwaukee County Behavioral Health Division partnership shows the strength and benefits of having law enforcement paired with mental health experts. And it's a model that has proven successful for several years here in the city of Milwaukee. And our data shows that 80% of the time, CART is able to provide an outcome that does not result in an emergency detention. This is key as we look to address systemic inequalities upstream and resolve the root cause of our disparities, both at the local and national level. And I'm really excited to share that just yesterday, the county announced that the Mental Health Board approved the allocation of $500,000 from the Behavioral Health Division reserve funds to partner with Milwaukee County Sheriff's Office to create a county crisis assessment and response team, otherwise CART, as I've been talking about. This funding will allow our mobile crisis units to serve Milwaukee County residents, not just the city of Milwaukee. And these expanded CART teams will pair our PhD mental health clinicians with law enforcement officers to respond to situations when individuals call 911 and ask for mental health services or identifies that mental health symptoms may be present. This partnership really focuses on increasing public safety through thoughtful collaboration to bring more resources to those who have been historically underserved and unable to really access the mental health services that they need here within Milwaukee County. I want to say thank you to Anjoli, one of our PhD mental health clinicians that currently serves with one of our health department CART divisions. And thank you to the Sheriff's Department for joining us to highlight this important partnership. And with that said, I'm going to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we've had 25,103 confirmed cases of COVID-19 in our community and 416 individuals who've died. We continue to see promising trends in the county with our percent positive tests right around 5% and lower hospitalization numbers than we've seen so far into the pandemic. We're also continuing to see low rates of individuals getting tested, and this is concerning. So we want to continue messaging that anyone who has symptoms of COVID-19 or has close contact with someone who tested positive for COVID-19 or anyone who's referred by a public health or healthcare provider should seek out testing. And you can call 211 for a testing appointment or go to a National Guard testing site for immediate testing. So while we see stable numbers with relation to the burden of COVID-19 infections, we know that one of the crises within the crisis, the mental health effects of COVID-19, and the inherent fear and isolation that coexists with the pandemic remains very real. As the county executive outlined, our EMS calls demonstrate the degree to which mental health has been influenced by the times that we're all living through. Our frontline responders, that's our law enforcement, and especially our firefighters, our EMS providers, they often see the first indications of health concerns in our community. Our EMS system, through 911 calls, can detect mounting concerns well before they show up in hospitals, and certainly before they show up at the medical examiner. Indeed, in March, as mentioned, we began to notice dramatic increases in our mental health, our overdose, and our suicide attempt-related EMS calls, more than doubling at the time in the case of suicide attempts. It can take some time for these numbers to show up in the remainder of the medical fields. And indeed, last month, we saw a substantial year-over-year increase in completed suicides through the Office of the Medical Examiner. This gap between calls for mental health-related issues and increases in completed suicides, in addition to what we already know about the progression of a decline in mental health and well-being, demonstrates that there's a key time to intervene to prevent the worst. This is why it's so critical to reach out to those who are struggling. And for those who are facing these crises, to know that they're not alone. Please reach out to those around you, whether it's your friends, your family, your neighbors, your coworkers. This is an incredibly stressful time for many due to fear, economic apprehension, disease, and isolation. We have a tough fall and winter to come, perhaps the hardest winter that many of us have ever seen. So be kind to those around you, whether you have the same viewpoints or not, and reach out. Sometimes it can be the most important thing that you can do to prevent the progression from a 911 call to a suicide. Thank you very much. Stay safe, and I will hand it to Director Rausch of the Greenfield Health Department.
Thank you, and good afternoon, everyone. I'm pleased to join you today to provide a data update from our COVID-19 Epidemiology Intelligence Unit. Let me go ahead here and share my screen, and we'll jump into the data for today. A lot of things are going on this week, and there's a couple highlights to point out in the whole county report, but one of the things I'll show you on the KID report, specifically here, this is children under the age of 18, is that we have seen a steady number of kids both in the suburban communities in blue as well as Milwaukee over the last about a month and a half. So not decreasing, not increasing, but relatively stable is where we are with the report for KID cases of COVID over the last month and a half. When we look at the whole population, it's a very similar trend, but it's a little bit pointing downward. We see that for the last about week and a half, the suburban 7-day rate and the city of Milwaukee 7-day rate is very close in proximity. We've been trending very stable and very steady over the last several days leading up to the end of this report. We will reflect on this report going forward that the last 4 days are preliminary data, so we don't want to ascribe any trends to them yet because we always see additional case reports and lab results come in that will bump that number up in the preceding weeks or in the succeeding weeks. The number of deaths in the county has been very stable. It's been a low number, but it's been very stable across both the suburbs and Milwaukee County for the last several months, really since mid-June. We've been pretty stable in terms of deaths. When we look at our reproductive number, largely things like following isolation and quarantine, wearing masks will drive that transmission rate down. We have seen that since the Milwaukee mask order went into effect in July, on July 16th, as well as 2 weeks later when the statewide mask order went into place, we have seen general fluctuations, but largely that transmission rate has been below 1, which is what we need to suppress disease. And likely both mask mandates are driving some of the decrease in cases, both within the city and within the county, as you see here. We want to talk a little bit about demographic patterns. This is something that we've been watching carefully, obviously, for several months. And what we continue to see is that the young adult, the 18 to 39-year-old age group, continues to grow quite rapidly. That group has surpassed the next largest group many, many months ago and been pretty much growing unchecked since mid-May. While the 18 to 39-year-olds have the most cases, they also now have the highest rate of disease in our community, and their rate has increased to almost 37 cases per 1,000 population. By comparison, our oldest age group, which was really affected and impacted early, has a rate of 24 per 1,000. So that continues to be a trend that we watch carefully. Similarly, we watch trends in race and ethnicity here in the bottom left. The Hispanic population has been leading the way in terms of number of cases for many months, but we can see here that the whiter Caucasian population is very close to surpassing the Hispanic population. And while the numbers might be approximate, the Hispanic population is more than 2 times likely to develop COVID compared to the next closest population groups when we talk about rates. We haven't talked about hospitalizations recently in these reports, but I do want to reflect there's a couple interesting changes. Recent data indicates that the 18 to 39-year-old population has surpassed the 80-plus population for number of hospitalizations. So we can see here when we look at age, the 18-plus population has increased over the older population, but the highest rate remains in our oldest age group. And additionally, African Americans and Black population has had a highest rate of hospitalization as well. When we look at deaths, we haven't talked about deaths recently either, but one thing of note that we've been tracking recently is that in recent weeks, the white population here in the bottom left had approximated and kind of followed along with the African American population for many weeks, but has recently surpassed and continues to grow in terms of number of deaths in the community. But so that's something that we still want to continue to look at and pay attention to. Next, we'll talk about testing coverage. As Dr. Weston mentioned, we've been on a decrease in terms of number of tests completed since early July. This remains an issue. We see a steady decrease, and while our percent positivity numbers have been positive and trending in the right direction, hovering about 5%, it's certainly concerning to us that we have so few tests in the last few weeks. Right now, we're at about what looks like 12,000 tests in the last week, and that compares very negatively to almost 30,000 tests in early July. So it is something that we want to note. Lastly, we'll look at the spatial maps. This is the map of new cases that have existed for COVID-19 in Milwaukee County since early March. Cases throughout the county. When we look more recently over the last week, we see slightly different patterns than we've seen in the past. We have, for the last several weeks, seen a lot more cases south of 94, the southern part of the county, but we see a little bit more variation this week. Hotspots on the east side, hotspots throughout the southern part of the city of Milwaukee into the southern suburbs as well. And this is something that we'll want to pay close attention to. The data shared today indicates there's still considerable COVID disease, as we've talked about over the last few weeks, with several key themes. The COVID data in Milwaukee County portrays an interesting story and one that we continue to look into further as part of our data team. Overall, as the pandemic has unfolded in Milwaukee County, it seems to be the story of the outbreak within the outbreak within the outbreak. And what I mean by that is that we can see trends over time where the pandemic started on the north side of Milwaukee and largely impacted the African American community. Next, the pandemic moved into the south side and significantly impacted the Latinx community. And lastly, and more recently, we've seen the expansion of COVID-19 into suburban communities, increasing cases both amongst the white Caucasian population as well as the younger population. Overall, we've seen that younger persons in the lowest age groups, 18 to 39, 40 to 59, as well as our School children and that population under the age of 18 have had the largest increase in cases since mid-May. Overall, this is not okay. We don't want to see cases growing out of control in Milwaukee County. Regardless of who is impacted, we need to continue to do our part to limit COVID-19 throughout the county. Wear your mask, watch your distance, wash your hands. It's a message you've heard more and more over the last several months. The data continues to support that testing has dramatically decreased since early July, but yet we know tests are readily available. So we want to continue to urge you, if you feel like you need to test, symptomatic or not, you can seek out testing. Call 211, find a testing site, get tested. Testing remains an adequate and important part of the strategy to contain COVID-19. And without adequate testing, we can't identify those that have been exposed, those who have disease, and appropriately quarantine those that they have exposed. Lastly, when we speak of quarantine, we need to remember that this remains an essential strategy to containing the COVID-19 pandemic. We quarantine exposed individuals so they cannot continue to spread disease unchecked in our community. And a negative test does not indicate that we can stop quarantining, as this graphic demonstrates. And I'll just share my screen one last time to show an important graphic that my health department borrowed from the Oak Creek Health Department. So all kudos to Oak Creek for originally putting this together. But what this graphic is trying to portray is that it takes 14 days from the time of initial exposure for you to develop symptoms of COVID and potentially test positive. So if we look at a scenario here over a 14-day period, if you had exposure on day 1 and get tested on day 3, you may receive a negative result on day 7. That doesn't mean quarantine ends. It's important for that entire 14-day quarantine period to occur. Because in this scenario, if you attended a family gathering on day 8, and then you develop symptoms on day 10, got tested on day 11, and then received positive test results on day 14, it's important to be quarantined because you limit your exposure to other individuals. So it's a very important reminder. If you know that you've been exposed to somebody with COVID-19 and you've been told by public health, you need to self-quarantine for 14 days and monitor yourself for symptoms. It is one of the most important strategies that we have available to controlling COVID-19 in our community. I thank you for your cooperation, and I'll turn the briefing over to Catherine.
Thank you, Director Ausch, and that's a great graphic to highlight and explain that narrative, so appreciate it. Next, we'll hear from Anjali Varnado, who's a CART clinician with the Milwaukee County Behavioral Health Division and MPD Specialized Patrol Division. Anjali, thank you for joining us today.
Hi, thank you for having me on behalf of Milwaukee County's Crisis Assessment Response Team.
Excellent. And if you want to just talk a little bit about your role with CART and the expansion that we just referenced with the Sheriff's Office, that would be excellent.
Sure. Pretty much I am a psychiatric clinician with Milwaukee County's Crisis Assessment Response Team, CART. My role is to pretty much provide hand-in, one-to-one services in the community to those who are experiencing mental health crises. Anyone that may be suicidal, anyone that's experiencing a mental health crisis related to even polysubstance abuse or whatnot.
Excellent. And I guess, can you give a little bit more context of how our community might be able to access CART and how that partnership has really created a benefit in our community?
Sure. Anyone in the community can contact Milwaukee Police non-emergency number. If it is not an emergent situation, the non-emergency number is 414-933-4444. If it is an emergent situation requiring police response immediately, you can contact by simply dialing 911. Another way is contacting the crisis line as well. If you are needing CART to be dispatched, you can call 257-7222, where they do screen to determine the appropriateness of CART's response as well.
And the county executive talked about that benefit and having that partnership and being able to de-escalate situations. Can you explain some of the training that you and the law enforcement go through that really make up the CART team, and perhaps provide some examples of situations you might respond to?
Sure. Well, I am a master's level psychiatric clinician. So I have the educational experience and training. We also go through crisis negotiation training that lasts for at least a week and a half or so. Officers do go through that training. Also crisis intervention training, which is led by CART, where we are taught how to de-escalate crisis situations, officers as well, of course. Basically a non-violence approach to de-escalating crises as they arise.
Excellent. And I think as the mayor and the county executive referenced, today is World Suicide Day. Is there any tie-in or examples, again, how you might be able to respond and help individuals who might be experiencing suicidal thoughts?
Well, like I stated earlier, if someone is to call into the police, we are then dispatched. We can provide community-based resources through crisis case management, the CARS Crisis Assessment Response Recovery Support Program, where you are then issued a case manager who helps you identify what your crisis needs may be and your individual goals to help you work towards a way in which you can work through those crises when they arise, connecting you to community-based resources to prevent crises from arising. And also if you do experience suicidal ideations, that you are able to work through that by preventing hospitalizations if possible, or even a visit to jail.
That's really important to hear how those outcomes can really help individuals in the community. And I think that sets it up well. We'll now hear from Ted Chisholm, who's the Chief of Staff with the Milwaukee County Sheriff's Office. And Ted will talk about that expanded partnership that Milwaukee County just announced with the Sheriff's Office. So Ted, we'll hear from you now.
Thank you, Catherine. Again, my name is Ted Chisholm, and I am the Chief of Staff for the Milwaukee County Sheriff's Office. And we are extremely excited to embark on a partnership with the Behavioral Health Division to roll out a 5-deputy CART team between 2020 and 2021. It entails 3 deputy positions that will be funded through this partnership this fall, and then 2 additional deputy positions that will be funded in early 2021. As Ms. Varnado indicated, these positions work in partnership with trained clinicians at BHD to intervene humanely and effectively in situations where community members are experiencing psychiatric crisis. One of our deep commitments at the Sheriff's Office is to a public health approach to communities. We very much recognize that our community right now expects an approach to public safety interventions that emphasizes the dignity and the humanity of all individuals with whom we interact. That's something that already is a huge part of our commitment to public service, and it really underlies our philosophy as it relates to CART. We're really looking forward to this, in part because our deputies right now do respond to a number of incidents in our community where individuals are experiencing crisis. We provide the primary police service on our county's expressways. We serve in our county's parks, and we also provide service to our courts and our airport. And in addition to those services, we also operate the Milwaukee County Jail. And whether we're responding to calls where individuals are attempting or engaging in self-harm or are experiencing other forms of crisis, it's really critical that our deputies have the tools they need to intervene in a way that everybody can walk away connected to the best resources available, and in a way that repairs trauma and harm, and does not connect individuals to the system of incarceration wherever possible. We're really committed to that approach, and we're happy to answer any questions about the team. Thank you.
Thank you, Ted. And we really appreciate that explanation and having Anjali here to explain that personal experience of what it's like working on the CART team and having that expansion with the Sheriff's Office. So thank you. We will move to the media Q&A portion of our briefing. Ted, I know we've only got you for about 10 minutes. So media, if you have any questions specifically for Ted, please make sure to chat them or let me know. The first question I'm seeing is for the mayor, for Dr. Weston, and for Director Roush, and it's from Sharon Bajenda with CBS 58. and she asks that all three experts comment on these questions. Bear with me, there are a few. So we know that UW-Madison is turning fully virtual beginning today due to a COVID-19 outbreak. First question, would you advise UW-Milwaukee and other city universities to follow the same footsteps if an outbreak were to happen? Second question, how does the Milwaukee campus compare in case numbers to what's happening in Madison? Third question, would you advise a ban on gatherings if case numbers continue to climb? And finally, do you feel campuses in the city are taking enough appropriate steps to control the spread? And how often are you communicating with them?
Well, let me start out here. I think that what's going on in Madison, it's clear not only in Madison, but around the country, we're seeing at college campuses outbreaks, particularly off campus where young people are congregating, oftentimes in defiance of the rules that have been set forth by the colleges or universities. But it's not shocking since we're talking about young people who feel that they're invincible. I think that Madison obviously has taken the right steps. When you look at the outbreak that has occurred there, our health department is in communication with all of the colleges and universities here. And if we see something, obviously we will take whatever steps are necessary. But I think it's premature at this point because I haven't seen any data that leads me to conclude that we have to take those steps now. But if we see it, we obviously are going to take the steps.
Yeah, I would agree. I think I'm looking at the questions that I jotted down here. I'll try to kind of answer them all in one swoop. I think the mayor answered it perfectly. I think each case has to be taken individually. Milwaukee County right now is seeing fairly promising trends in the numbers. I think the testing numbers are concerning, but the positivity numbers, the case counts per day, the hospitalization numbers are all moving in a fairly promising direction. Now, that can definitely be transient. That could change next week. We hope it doesn't. We know that back to school, whether it's college, high school, elementary school, is something we haven't gone through before, locally or as a country. And so that's going to be a change for us, and we're going to have to monitor closely and see what changes. But to say that because school X that had an outbreak affects school Y, I think is challenging. I think each school has to work with their local health department, with the policies and procedures they've set up, and do what is going to be safest for their students. As far as gatherings, I think gatherings that are unsafe should not be happening no matter what the situation. So our numbers are looking promising in Milwaukee County, but to have people going to, large indoor gatherings are not a great idea. Outdoor gatherings where people are close without masks, not a great idea. So I think we have to be careful. We have to think about whether it's people, space, and time, the 3 W's, however you like to think about it. We have to be very cognizant of what we're doing and be safe how we do it.
Yeah, and I would completely agree with everything Mayor Barrett and Dr. Weston said. Each public health department who has a university system school within its jurisdiction, or even other schools, private or otherwise in their communities, have had ongoing conversations with those schools to plan, to prepare for these exact eventualities. While Madison is currently in a situation where the UW-Madison campus had a lot of cases, we're not currently there with UW-Milwaukee, from what I know, based on conversations with regional colleagues this morning. But if we get there, I assume that appropriate and necessary public health actions will be taken when the time comes.
Thank you all. Our next question is from Kent Wainscott with Channel 12, and Kent would like to ask the question himself of our guests. So Kent, if you'd like to come on.
Thank you. Mayor, actually, I now have two because I want to follow up on your last remarks there. Were you concerned at all when you saw the remarks from the Dane County executive suggesting that the university shut down the dorms and send everyone home? And then I have another question.
I wasn't concerned. I was impressed. I think County Executive Parisi took exactly the actions that were necessary. I think that he understands that the impact, and they are following the numbers very closely, just as we're following the number of cases very closely here. So I think he was part of the solution, and I think that that's important.
Okay, the other thing I want to ask about, and I know it may seem a little bit early, but there are cities around the area that now have started with kids going back to school to put their COVID guidance for Halloween out. Will there be trick-or-treating in Milwaukee this year?
Well, that is I'd say the $100 million question, and I don't have the answer to it. I will tell you, among that key demographic, the 4-year-olds to 14-year-olds, this is an extremely important issue. And obviously what we're doing is we're working with the health department. It's come up in a number of our calls because there is keen interest as to whether there will be trick-or-treating. And I think right now, I say to people, hold tight. Let's see what we can do. I am very encouraged by the fact that our percentage positive rate has dropped below 5%, 4.9% in fact. And one of the things that I think is important in this, that the place where we are disappointed is because we've had fewer people taking the tests. But one would think, one might assume that as the numbers went up, you'd have sort of a dilution effect, that you'd have a lower number of people testing positive. But here we're having fewer people being tested and the numbers are still going down. I think that's a really solid sign. But as Dr. Weston said, those numbers can be very transient and they could turn on a dime. And so I think that people should just, I understand the importance of this holiday. I understand the importance of this holiday, but I think we should make sure that we're doing it right. And I think give us a little bit of time so that we can make sure we're making the right decision.
Thanks.
Thank you, Kent. I'm seeing 2 more questions from Fox 6. The first one is for the mayor and county executive, and if our health officials want to jump in as well. It is, what are your thoughts on the Milwaukee County Archdiocese encouraging people to go back to church?
My response, that I haven't seen the specifics of it. We had a kind of short conversation in our office earlier today that there was changes taking place. I would simply say what I've been saying for 6 months now, or 5 months now, 6 months now, is unfortunately there are no exemptions to COVID-19 that have been granted for religious reasons, for political reasons, for athletic reasons, for academic reasons. And so whatever activities are taking place, no matter how laudable they are, no matter how religious they are, they have to be done in accordance with public health, because we've seen far too many stories of weddings or funerals or church gatherings or choir practices that have become large places where there have been large spreading of this disease. So I want to learn more about it specifically, but again, I think that we have to understand, no matter how laudable it is, there are no exemptions in place for this horrible disease.
And I would just echo the same comments as the mayor. I haven't really seen everything, but it's really about making sure that you're really following the guidelines that have been put in place and following what our public health officials are saying. I know that many churches have been gathering outside in some capacity, and it's starting to get a little colder. And I understand why folks are ready to go back to church. But we are going to ask people to consider to think about, one, wearing a mask. We know that singing can definitely continue to spread the virus when you're in closed spaces. But again, we need to make sure that no matter who you are, religious affiliation, business, that you are following the public health guidelines that have been put forth.
Thank you both. What I'm seeing, oh, no, there's 2 more questions. All right, so the second question from Fox 6 is for the mayor. And they're asking, with a September deadline looming for restaurants to submit safety plans for indoor dining, do we know how many restaurants have actually submitted their safety plans?
Unfortunately, I don't have that number in front of me. We can get that number. I'm happy to talk to Commissioner Kowalik and her staff, and we can get you that information. I simply don't have that information in front of me right now. But again, what this is all about is, for those restaurants that submit the plan, they can have what I would call expanded service, but it has to be done in accordance with the plan that is approved by the Milwaukee Health Department. I know a number of restaurants, I would say it's in the dozens now, have had their plans submitted and approved. So please continue to work with our health department so that we can make sure that if you are going to be reopening, or if you're going to be expanding your service, you're doing so in a safe and responsible fashion.
Excellent. That appears to be all of the questions that I'm seeing in the chat. So that does conclude our briefing. This also concludes my final briefing. I will be transitioning next week to my colleague Sydney Hofer. So just want to thank you all for your time. Media, please take note of the new media contact next week. It's been a pleasure facilitating these briefings, and we'll all be in touch.
Well, Catherine, thank you very much.
Thank you so much.
Good luck.
Thank you very much. Everyone take
Let's
care.
give her a round of applause.
Thank you, thank you. I'm taking a virtual bow.
Yeah.
With that, we'll all talk soon.
Have a good one, everyone.
Bye-bye.
Bye.
Thanks. Bye.